So think about how you can provide telemedicines if you're a healthcare professional, that is, remote healthcare. This is now widespread and it's starting to be used very frequently. Telemedicine and remote telehealthcare services has created new opportunities for staffing services for your organization. Healthcare organizations are increasingly seeking professionals with expertise in telehealth technology. Now, my book here talks about telehealth technology, and this was back in 2020 when the COVID was happening. Okay? Remote patient care monitoring, virtual care delivery. This is opening up opportunities for staffing agencies to recruit and place healthcare professionals who specialize in telehealthcare, telemedicines, such as telehealthcare nurses, virtual care coordinators, remote physicians. The demand is high. So, like I said, you could be specialist skills, could be healthcare, it becomes complex and specialized. So there's also the demand is for professionals with specialized skills and expertise, like healthcare staffing agencies can capitalize on this trend by focusing on niche areas such as critical care, oncology, mental health, advanced practice nursing. That can be a niche. Those four can be a niche in itself. By recruiting and placing professionals and specialized certifications and experience, you, the agency, can meet specific needs of healthcare facilities and command a higher rate for their services. But you've also got to be flexible. Look at being flexible. When I say flexible, it could be that you're providing staff at very short notice, for example. Okay? So you could look at the flexible staffing models is a way that's transforming healthcare organizations and managing their workforce. So healthcare facilities are increasingly turning to staffing agencies to provide flexible solutions that allow them to scale or down base on demand. So they can reduce their labor costs because they're going to have shortages, and you're there to meet their needs, not the other way round. So you'll fill their temporary and short-term vacancies, but you can also offer permanent. If they really like someone and they've still got this shortage, then it's give and take. You give them a little bit and then you'll get more back, for example. Don't think, I'm not going to give my staff because that means I'm not going to have anyone. You could just get another staff member. You made a commission that's going to, say for example, if it's a nurse, that's, probably 7 to 12 grand, for example. Then use that, reinvest that to advertise for another specialist. So healthcare facilities are increasingly turning staff agencies into flexible solutions. And like I said, it will reduce their labor costs. It will fill their temporary or short-term vacancies. You can leverage, and you can also offer this on-demand staffing services. There's also flexible scheduling arrangements which meet evolving needs of the client. Technology is revolutionizing recruitment processes in healthcare staffing. And we need to think about now things are getting faster. It's more efficient, it's more targeted. There's recruitment platforms, applicant tracking, known as ATS, predictive analysis, enabling staffing agencies to streamline candidate sourcing, screening, and placement, reducing time to fill rates. And you can improve your candidates' quality by investing in technology-driven recruitment solutions in the healthcare staffing arena. And you can get the competitive edge for this as well by providing efficiency and delivering better outcomes for clients and the candidates. So there's also diversity and inclusion. There's initiatives that's out there that is diversity, equity, and inclusion, and they've become increasingly important in prioritizing healthcare organizations. And this is driven by the need to address the health disparities and promote cultural competencies and create inclusive care environments. Healthcare staffing agencies need to play a vital role in supporting the initiatives by prioritizing diversity in their recruitment efforts, promoting inclusive hiring practices, and providing training and education on DEI topics, because some people need to know what that is and what it involves. By partnering with diverse candidates and healthcare organizations committed to DEI, staffing agencies can contribute to building more equitable and inclusive healthcare systems. So you can say that this is what you also specialize in. You could also look at the travel nurse industry. That has gone huge. And there's also allied healthcare professionals as well. So the demand for travel nurses and allied healthcare professionals, it continues to rise, driven by staffing shortages, seasonal fluctuations, and the need for specialized expertise. You can use travel nursing and allied healthcare assignments to offer healthcare professionals the opportunity to gain valuable experience, explore new destinations, and enjoy competitive compensation packages. Like, for example, travel nurses, they can get like 3,000 to 6,000 you can be charging a week, for example, depending on what your rates are. So with some organizations, like government organizations, they want a full breakdown of why you're charging what you're charging. But with this, it is not the same. With travel nursing, you're providing to the hospital, for example. So healthcare staffing agencies, you can capitalize on this trend by expanding to travel nursing and allied health divisions as well, offering attractive travel assignments and providing comprehensive support services for traveling healthcare professionals. So it's important for you to think about what these trends and opportunities in healthcare staffing present. It's so exciting for you, the staffing agency, to expand your service offering and meet the evolving needs, because you can't just stay the same. You've got to grow. So I just want to talk to you about a small case study. give you one example. A client of mine, Hannah, in 2020 there was COVID, as we all know, for example, and Hannah was going to various locations, for example, but she wants to expand in to become, she wants to become a national agency, but also at the same time it would be very difficult to do that in one go. So I then suggested, why don't you do a franchise? Why don't you become a franchise whereby organizations will pay you a fee to use your model, and then you can then be national and you still get residual income. Now, with Hannah, she provides high quality staff, nurses, midwives, for example, and she trains them to the highest level. And I think it's important that we all take on this same type of methodology. We look at what the big organizations are doing. Another example is in London, for example. They were doing home care, just purely home care, 4,000 hours a week. I said, why don't you do recruitment care agency? And they're both running very successfully as we speak. So always, like I said, always reach for the stars, always aim higher, because if you're up here and if someone knocks you down, that's fine. But if you start off at this level and then someone knocks you down, that means you're going to get below what you actually wanted. Yeah? So whatever you get that's high level, and if they knock you down a bit, you're still way above what you expected. But you got to make sure that you've got the right staff members to be able to deliver the package, and that they've got the right qualifications, and that their qualifications are of high value, and that they've got the relevant DBSs, of course, we all know that, the updates, but the extra training that they do, or maybe you could provide as an organization, so that you are recruiting the high caliber staff members. I really do hope that you found this helpful today, because this is day one of the 5-day challenge. I've really enjoyed training you today and talking to you about the basics, foundation, and tomorrow we're going to go into more. Like I said, we've got the next level, which is, this is the 5-day challenge. So I'll just tell you what we're going to be covering tomorrow, just so that you've got a bit of an idea. Hope you've enjoyed the training so far. Let's have a look here. Day 2. So day 2 we cover the legal and financial preparations. Now, I am not a lawyer, but I'm going to go through the financial preparations, your business plan, okay? How you're going to register your business, what licenses you may need. Depends where you are, whether you're in the UK or whether you're in America. You need to understand this aspect as well. Obviously, after the training, you seek legal advice as well, because like I said, I'm not a lawyer. All I can do is talk to you from a business person's point of view, and having run my own agencies as well as in the UK and in America, for example, I do have a good understanding, and we've helped clients to do the same as well. So I hope that you've enjoyed today. I've really enjoyed training and talking to you today, and I hope that I'm opening up your mind so that you can think about recruitment, care agency, healthcare staffing, recruitment agency is a thing which you can add on to whether you're doing home care already. Great, add this on. Don't just stay in one place in home care. Like with me, I did home care first, then I did recruitment agency second. But just from the home care alone, I was able to build multiple seven figures from that. Okay, so I hope that you've enjoyed today, everyone. It's been such a wonderful, I've really enjoyed talking to you today about what we've just discussed. And do join our YouTube channel, like and subscribe. Team, if you can put that into the chat so that everyone's got our YouTube channel. It is going to be so amazing. We've got some membership programs as well. You know, at the end of the day, we want to try and get as much educated as possible as business owners, as care providers, and we need to do that so that we're able to help our team members, so that we're able to help our staff members, and in turn it's going to help our clients who receive our service. So do join me tomorrow. I look forward to you joining us. Subscribe to our YouTube channel for further training updates as well. Have a wonderful evening. I look forward to speaking with you all soon. Take care. I hope you've enjoyed day 1, and tomorrow we will start day 2. You can always watch the replay as well. So thank you so much, everyone. Take care. Have a wonderful day. Thank you. Goodbye.